Ambulance 188, we have a male, 60 years of age, generally good health, no time, but having difficulty obtaining medical history. Patient appears confused, lack of clear response to questions. Patient may have ingested, but claims not to remember amount or possible dosage. Says he's unsure of reason for medication and requests permission to start D5 and transport.
Ambulance 18, last message garbled. Please repeat.
Welcome to emergency medicine, where electronic static makes good decision-making almost impossible. Many of your patients have the same experience, not in emergency medicine, but in your office, in a hospital, a pharmacy, or even trying to get a bus. Low health literacy is the communication static that distorts information, creates confusion, and leads to poor quality health care for millions of Americans. We call this static low health literacy, and it's pervasive in our society, not only in your office. A fundamental observation of this report is that health literacy is a social problem as well as a medical problem.
Health literacy is a problem that everyone has to have a hand in solving. Most of us who take care of patients don't really appreciate how little many patients understand. Half of all adults in America are unable to understand much of what they need to know to take care of themselves and to follow their doctor's instructions. I believe that people can do a lot about this problem. They can do a lot to help themselves, and we can do a lot as a community to improve our ability to function as literate society.
More than 300 studies show a lot of printed health information, like insurance forms and prescription labels, are written above the average reading ability of American adults. We are just beginning to understand the scope and seriousness of low health literacy in America. Why should you care? Let's look at the numbers. As many as 90 million U.S. adults, nearly 1 in 3, have limited English and math skills, and a substantial percentage of that number cannot function effectively in the context of their own health care. 40 million Americans have trouble with tasks requiring them to find or match several pieces of information in more complicated texts, like dosage tables, for example. The remaining 50 million adults find it difficult to perform operations that are complicated by distracting information in complex language.
Suppressive. What is a suppressive? And what is a spectrum? Those things I really don't understand what they mean.
The design of medicine labels also makes it hard for patients to use the medicine correctly.
I took one pill, and I didn't even look at the bottle. I figured it was just, a pain-killing pill. And half an hour later, I took another one, and then an hour later, I took another one. I kept taking them. On the bottle, it says, take one and needed it when you needed it.
They can't fill out a comprehensive medical history.
Sometimes we get these consent forms where we have to sign, but there's a lot of reading involved, which I can't do, so usually what I do is sign them.
And sometimes they simply don't understand what it is you're saying.
Sometimes the doctors and pharmacists use the type of the words that, that sometimes it's hard. I mean, sometimes there's some word that is there, but you don't know what they mean. They be using those fine words, those college words. It's hard for people like me to understand and read.
This means that while these Americans can find the words child, children, or even pediatric on a package of children's cold medicine, they probably cannot read a chart that calculates the correct dosage for a child by age and weight, especially if the instructions include a footnote to indicate that weight is more important than age. Many can't follow signs in a hospital hallway that say, for example, cardiological services instead of heart care, or use a bus schedule to get to an appointment on time. You don't have to be a social scientist to see what that means to you. Low health literacy can lead to improper use of prescription drugs, overdoses, inadequate treatment, even catastrophic medical conditions resulting from failure to follow instructions. Incomplete medical histories can cause misdiagnosis, and partially understood consent forms can result in unnecessary, even incorrect surgical procedures.
So I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part in my body, and I didn't know it?
Limited health literacy, as currently measured, is more prevalent among the elderly.
My Aunt Winona took the one she was supposed to take in the morning and the other in the afternoon, so she knew she would forget, so she took both of them in the morning.
As the American population ages, the challenge of low health literacy will become a larger problem and may contribute to a world in which those most in need of health care may be those least able to benefit from it. What are the symptoms of low health literacy? If you saw a patient massaging their left arm or sweating profusely, you'd be alert to the possibility of a cardiovascular problem. The same is true for poor health literacy. There are signs that alert practitioners will notice. Do you notice when patients ask you to go over instructions because they forgot their reading glasses? Or ask you, "Just tell me how to take this"? Shame and stigma associated with low health literacy may cause patients to attempt to hide their condition, masking their confusion to avoid being perceived as ignorant. America is more of a melting pot than ever. Some minorities and many recent immigrants face severe health literacy problems, often complicated by foreign language and cultural differences. Take once a day, translated into Spanish, should read, "Toma una vez al día." But if you mix English and Spanish, as many new language learners do, then the word once in English becomes once or 11 in Spanish. A Spanglish speaker could easily interpret take once a day to mean take 11 a day. But culture is more than mistranslated words. It helps define who we trust most, a professional physician, a family member, or a friend. It gives the concept of illness itself meaning in a human sense, as well as a biomedical frame.
And what do you take that medicine for?
Don't ask me. He puts me on there, and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
And today, culture is also mass culture. The incessant barrage of mass media messages, health news, advertisements, web chat rooms, information and misinformation influence what our patients hear, understand, or believe. Look, I'm a physician, not a teacher. Isn't this a problem for the schools? Yes, schools are involved. So are adult education centers. Limited health literacy is a social problem. But it is our healthcare system that creates much of the confusing static, our jargon, complicated forms, and confusing signage. We are therefore responsible for solving it as well. The good news is that we are learning how to address the problem. 3 approaches show important progress. Professionals in health communication and health education are focusing attention on culturally appropriate audience research as one way to prepare written and visual materials that work better. The patient advocacy movement is helping to change systems and prepare friends and family for the role of health advocacy. And medical education is beginning to recognize the critical importance of patient communication in the training of healthcare professionals at all levels. But we need more research on causal models and better measures of health literacy. We need more demonstration programs to expand our evidence base and more attention to policies that support health education in the schools. In sum, the Institute of Medicine report demonstrates that health literacy is a system problem, not just a characteristic of patients alone. Education, culture, and health must work together to solve it. We have to attack the causes of the static in the doctor's office, in the hospital, and the school, in conversations and in signage, as well as on websites, television, radio, and in advertisements. We as doctors can make a difference by helping bring clarity to our patients' medical experience, and we as citizens can support the research agenda needed to understand health literacy. This video was based on the findings and recommendations of the Institute of Medicine Committee on Health Literacy. The full text of the executive summary with a complete set of findings and recommendations is also available on this CD, as well as the executive summary of other relevant IOM reports. Please use this CD to educate others about health literacy and what they as healthcare professionals can do to help.